Hello, I'm Paul Esposito. I'm a pediatric orthopedic surgeon at the Osteogenesis Imperfecta Clinic at the Children's Hospital and Medical Center in Omaha, as well as the University of Nebraska Medical Center. This video is going to cover the basics of splinting of a child with osteogenesis imperfecta when they have an acute injury at home. This was germinated from an opportunity that I had with Dr. Mary Peterson at the Osteogenesis Imperfecta Conference, where parents expressed an interest in learning how to do the basics of splinting until their children could receive definitive medical care. What we're going to demonstrate next is just a basic long arm splint, and we're going to use the fiberglass material again. And what I found helpful sometimes, just do a quick measurement, and I measured her arm and it came out to be 9 inches. So this material is 2 by 10. So that should be just right. So again, as soon as you open it, it starts to set. It has the padded side. It has the side that goes out. We're going to wet that. Dry it on the towel as much as we can. Again, the padded side goes out along the outside or ulnar side of the wrist and up above. And generally you're going to want to test her wherever she's comfortable. If it's an elbow injury you're trying to splint and the arm's held out in about 30 or 40 degrees, that's where we'll put it. If it's just a matter of it's hurting, and again, it takes 4 or 5 minutes for this to set max, and you should be talking to the child and trying to calm them down, because kids like to be paid attention to. And again, we're holding and supporting the arm, not forcing it in any position. And again, if the elbow's bent and crooked, just splint it wherever, whatever position it's in. Don't try and be fancy. And again, we never put our fingers in and leave them there. Our hands are always moving a little bit, or using the palms of your hand to kind of mold it gently around the child's arm. Again, if we're going to use plaster, I'll usually add another little splint across here because that material is not strong enough. So we just put a little oblique slab. The idea of splinting too is it's never circumferential, so you don't have to worry as much about circulation. What we're going to demonstrate now is a long leg splint in an infant. And basically, if you're concerned about a femur fracture, you have to mobilize all the way to the top. And what Dr. Peterson and a number of the mothers have talked to me about is making sure that this goes up enough but doesn't rub into the chest, and that you wrap an ACE wrap down here, leave the diaper part open, and then use a second ACE wrap around the waist. So again, we've got our material. This is a 3 by 35. It's 3 inches wide by 35 inches long, which is obviously going to be way too long. Now, while we're doing this, we're allowing this baby to eat just to keep them calm. You want to be a little careful of giving them too much too fast. And again, bring it all the way up so it's above the waist. We're going to cut that to the length we believe it should be. And you have a few minutes to work with this material, especially if you don't wet it until you're done. And again, we're going to fold it back, cut off that little bit of excessive. I made it a little longer than I wanted it to be, so that we could then fold the foam down and over it. And I'm going to wet it now. And our patient's quite interested in this part of the process. We're again going to dry it. And again, take the padded portion, put it either underneath the leg, or the way I like to do it is on the outside of the leg, around the waist. And we'll take our 1/8 wrap and wrap the leg part. And again, if we're going to do it just for a tibia fracture, especially in an older child, we'd end it up here on the thigh as high as we could. But for a femur fracture, it has to go up and above the waist. And again, we're folding it under and contouring, holding the leg steady. And again, this is a temporary thing, so if you happen to get the diaper underneath it, that's no harm. And the second ace wrap will go around the waist. And children with OI tend to have really fragile spines too, and I actually probably cut this a little too short. It should have been a little higher. So then we're going to wrap it around the waist. We'll lean her forward, again avoiding any sudden quick motion. And place the second wrap around the waist. And at least temporarily bring it around her buttocks, just to secure that. That way you're immobilizing the hip up around the waist. This is an area that tends to rub, so it needs to be padded pretty well. And honestly, should have put that up a bit higher. But again, the goal is to make your child comfortable, splint them until you can make sure that you're getting to the right place to get your child taken care of. So again, you should never end a cast or a splint on a child with OI in the middle of the femur, because that puts a stress point on the femur. Even if we're doing it for the tibia, we'd get it up as high as we could there. But for a femur fracture, you must wrap it up around the waist. And again, we'll mold this just gently to the child's leg. We're putting a little gentle traction on the leg at the same time if it seems that it's necessary. And whatever we need to do to make the child calm and comfortable. And just hold it until the fiberglass material gets firm. We hope that you find this video helpful in terms of doing basic first aid and care for your child until you can get them to a definitive care facility. We also want to thank the manufacturer of the splinting material that we used, which I found to be lightweight and very helpful and has a long storage life. There are certainly many products on the market that are helpful, and I'm not endorsing any one particular one. I just think you need to look for something that's lightweight, that has a lifespan that can be useful for you. If you have other questions or concerns, you can certainly contact our clinic or the OI Foundation website, which is very, very helpful.